December is National HIV/AIDS Awareness Month, a virus that affects millions of Americans.
HIV.gov estimates over 1.2 million Americans are currently living with HIV, and 1 in 7 don't know their status and need testing. An estimated 36,000 new HIV infections occurred in the U.S. in 2018. This is on par with the 4-year average, around 38,000, with the highest rates occurring in the southern states. Missouri was listed as a priority state in a recent initiative by HIV.gov aimed at ending the HIV epidemic by 2030. NewsNation reporter Francis Lynn takes a closer look at what lawmakers are doing to address this issue.
The relationship ended and the person felt that it was necessary for them to press charges against me for not disclosing my HIV status.
Robert Suttle has been living with HIV since he was 24 years old.
I was eventually convicted in 2009, which resulted in me spending 6 months in a Louisiana prison.
The current Missouri HIV criminalization bill has the same language as the one Suttle had encountered in Louisiana. Right now, the bill states anyone who knowingly transmits HIV to another can be charged with criminal offenses, even if they're taking precautions to prevent transmission.
I felt that I disclosed as best as I thought I could. I was absolutely taking antiretroviral treatments from day one when I received my diagnosis. There's antiretroviral treatment for the person living with HIV, and then there's also PrEP, which is for people who are HIV negative.
Lynn Meyercord with AIDS Project of the Ozarks and Representative Crystal Finelli say now is time to revise the bill to reflect current science and medical resources.
Between the prevention medication and the medication to suppress the virus, people basically aren't contagious.
HIV has become a manageable disease. We've been able to forestall the progression of HIV into AIDS. Right now in our statute, if you engage in a knowing transmission of HIV, the punishment is an A felony, which is what we give for first-degree murder.
Meyercord says the bill is so outdated, not many cases fit the language of the bill anymore.
If someone's positive, they can get on treatment, they can become virally suppressed. They're no longer a risk to public health.
Part of this bill hopes to change those incentives and encourage people to get tested and know their status so that this disease does not get unnecessarily spread.
Francis Lynn, NewsNation.